Today I will be doing an ultrasound demo of scanning the liver. I'm going to start with the patient in supine position, and I'm going to use a curvilinear transducer. So to start, I'm going to do a quick sweep through the liver just to make sure I'm using the best windows possible. Patient, can you take a deep breath in? And breathe. On a harder patient, you might have to use an intercostal window, but on this patient, I think I will be using midline for most of my images. All right, when you're ready, can you take a deep breath in? So I'm first gonna start by sweeping through the left lobe of the liver. I'm gonna start at the caudate lobe and then slice out laterally. My next image is going to have the aorta in it, and I'm just going to continue to slice out, making sure that I can see all the borders of the liver as I'm slicing. You can breathe. And make sure I go all the way out to make sure there's nothing pedunculated or hanging off of the liver. So then I'm going to do a long sweep through the right side, the right lobe, and you're going to start at the caudate lobe again. When you're ready, deep breath. The next picture is going to have the IVC in it. You can breathe. For the right lobe and long, I'm going to drop my depth, and I'm also going to drop my frequencies to get rid of some of the shadowing from the portal system. Deep breath in when you're ready. You can breathe. When you're ready, deep breath in. And I'm just going to continue sweeping out all the way out. You can breathe. Then the next image is going to be a liver kidney picture to compare echogenicities between the liver and the kidney. Deep breath in. You can breathe. And then I'm going to, at the mid-clavicular line, get a measurement of the liver. Deep breath in. On most patients, you're going to be able to see the kidney along with the liver at this, you can breathe, at this location. And you're going to measure from the dome of the liver out to the tip of the left lobe. If they have an enlarged liver, you might not be able to see the tip. And you can either use an extended view or eyeball where the tip is to measure. So next I'm going to do a sweep through the liver in trans, and I'm going to start again in the left lobe. We're going to do superior to inferior. And when you're ready, deep breath in. I'm going to put my frequency back up because you can breathe, because I don't need to penetrate as deep for this sweep. When you're ready, deep breath in. to make sure we see hepatic veins, portal vein, ligamentum teres, and then just getting, you can breathe, a little part of the pancreas in there. Next, I'm going to do a trans sweep of the liver in the right lobe. Same thing, superior to inferior. I'm going to drop my depth again and my frequency. When you're ready, deep breath in. Making sure, once again, we see the portal system, the hepatic system, and I'm gonna start moving laterally to get all the structures that I wanna see. You can breathe. This last slice in trans is gonna have the gallbladder and the kidney and the liver in it. And you can breathe. This patient in particular has a pelvic kidney on this side, so I have to go pretty far inferiorly to get all three of her structures in the same image. All right. So next I'm going to assess the vascularity of the liver by looking at the main portal vein. We want to make sure that flow is heading towards the liver in a hepatopedal fashion and that the flow is continuous. So I'm going to use an intercostal window to elongate her main portal vein. You can see her main portal vein there. You can also see the hepatic artery coming in. And then we're just going to get a signal on it. Can you just hold your breath? And breathe. Like I said, we just want to make sure it's continuous. And then the last thing I'm going to image is the common bile duct. You can see that running with the portal system and the hepatic artery. And we want to try finding it dumping in, as close to dumping into the pancreatic head as possible. All right, when you're ready, deep breath in. Once I think I found it, I'm going to put color, you can breathe, on the image to make sure I'm not elongating the hepatic artery. When you're ready, deep breath in. And breathe. You can see her stomach is going crazy. That's why I'm getting all this noise over there, but you can clearly see that the CVD is not filling with color. So I'm going to take a color image and then I'm going to turn the color off. I'm also going to zoom in a bit so that I can get an accurate measurement.